You may wonder why I am talking like that. I am going to just introduce you a small segment of the healthcare, like cardio-diabetes medicine. You may all ask me, sir, cardiology is going strong in our country and globally, and diabetes is going strong, everywhere. Why you talk about cardio-diabetology? It's a very right, sensible, thinking. But the cardiology and diabetes are going parallelly to each other. They are not meeting, but they are meeting at the patient. The patient has both. We know as per WHO, statistics, the T2DM is equivalent to cardiovascular disease. And the incidence of cardiovascular disease in diabetes is nearly about 70 to 74% as on date. And this is the cardiovascular disease in diabetic people is totally different. They present asymptomatically, so-called silent myocardial infarction. And they have, whenever they have a lesion, they have an extensive lesion, a multi-vessel disease. Each vessel has, multiple lesions and large lesions and difficult to penetrate lesions. And they not only have a vascular disease, but they have a cardiac myopathy too, because of the microvascular disease. Not only the macrovascular, but microvascular is also being affected, and an autonomic neuropathy is also there. When a diabetic patient gets a cardiac ailment, the outcome is very tough. Nearly double the rate is the mortality, and women get more of cardiac involvement when they are diabetics than in non-diabetics. These are all well-known facts in the medical profession. Therefore, I thought that we should create a platform for cardiologists and diabetologists to meet and exchange their experiences and try to apply that on the patients with the vision of preventing cardiovascular complications in diabetic patients, and if they have developed it, how to save their lives without morbidity and mortality, and how to rehabilitate them and see that their multiple complications are prevented. That is why the need for a cardio-diabetes medicine. And how to strengthen this? Cardiologists have to be more conscious on diabetic side. Diabetologists have to be more conscious on cardiac side. Therefore, with my colleagues in the world, mostly in the UK and US, I thought that we should get a structured, curriculum-based course for the youth of this country. Especially those who are doing their, who have done their MD, internal medicine, or DNBs, and some of the youth and some of the young cardiologists and diabetologists and endocrinologists of this nation, they should be presented with. The ultimate outcome is a fellowship course in cardio-diabetes medicine, FCDM. It's a one-year course. It's a blended learning course. You need not go all the way to a classroom and then sit there. The theoretical component or the knowledge component will be online. But it will not be a word format. It will be a classroom format. And you will be able to follow it up after a particular, portion. You will have an interactive session too. That is how your theory component or knowledge component is being taught. And assessment is also online. You can even record it during your leisure time after your clinics by about 11 o'clock. You can open it up and do that. And you need not only theory, but also you need clinical skills. That's a practice component. That will be by a face-to-face training under mentors in accredited institutions, monthly 2 days. Or sometimes, depending on the convenience of the candidates, we can even do that together for a week or 10 days. And if they are in a bigger institution or an institution with the facilities of a cardio-diabetes medicine, there itself they can undergo a training and there will be a clinical assessment. Finally, this fellowship is being given, which I assure you will be accredited by an university. If it is in India, it will be a UGC approved university. If it is global, it will be a WHO listed university. So that you need not have the legal fear of putting these titles after your name. This is what I am trying to, introduce to you all, a fellowship in cardiodiabetes medicine. We are also working for a certificate courses for a general practitioners. I think that's also in the anvil. You may all wonder when this course will be, available to you all. I am sure in July this course will be available with some trial runs which you can choose that. The registration, everything is online. All these formalities will be introduced to you in July, I am sure. And you can also give your inputs so that we will be able to upgrade this course so that the doctors of this nation will be trained and strengthened in skills in cardiodiabetes medicine so that they can offer the best to their needy patients. Finally, I would like to close down this introduction with what Dr. Eugene Braunwald said in the recent CSA conference at Mumbai. The future of cardiology is cardiodiabetes medicine. I am sure you will all agree with me. A day-to-day cardiologists see diabetic patients coming with cardiac problem. Diabetologists see diabetic patient getting into cardiac complication. I am sure this cardiodiabetes medicine is a need of the hour. I am sure with all your support, this course will reach to greater heights, not only in our great nation, but globally. Thank you, ladies and gentlemen.